Hi, my name is Dr. John Campbell. Uh, I'm one of the dentists at Legacy Dental, and lately we've been blogging a lot on our website about teeth whitening. We know it's a popular subject, and I just wanted to let people know about the way in our office that we have found is most effective for whitening teeth. All teeth whitening processes involve using some type of peroxide to lighten the teeth. And there are hydrogen peroxides and carbamide peroxides available, and they come in various strengths. And the difference generally between over-the-counter products and dentist dispensed at-home products and in-office products just has to deal with how strong the whitening gel is. Those that are sold over the counter have to be a little weaker because usually the gel will get onto the gum tissues and will cause some chemical burns if it's a stronger whitening gel. Those that are sold over the counter are weak enough that if some were to get onto the gums, you might get a little irritation, but not too much. Those that are used in the office are fairly strong whitening gels, and they really have to be applied by somebody that uh, knows what they're doing. If they get up on the gum tissues, they'll cause some pretty significant chemical burns. But if it's done properly, it can work well. One of the things that we have found is that the in-office whitening products are not really that much stronger. They're usually 3 to 6 times stronger than the things that might be dispensed by your dentist to use in your tray. And so if they're 3 to 6 times stronger, you're getting the equivalent of maybe 3 to 6 at-home whitening sessions, which is definitely enough to notice a difference. But oftentimes for many patients, they uh, generally need to bleach for 10 to 14 days before they're satisfied with their tooth whitening results. And so one in-office tooth whitening session oftentimes is not enough for many patients to feel satisfied with the results. So in our office, we usually tell patients they need to anticipate needing to come back for 2 and sometimes even 3 sessions to achieve the results that we'd all like with in-office whitening. And so as a result, in-office whitening is more expensive. You're basically needing to rent the chair in the office and rent the assistant to go through that process. And so that's the biggest reason for the disparity as far as the difference in cost, because the chemistry is fairly relatively inexpensive. It is a little more expensive. But it's not enough to justify the general significant difference in cost. The other thing is there are many people that ask about laser tooth whitening or zoom tooth whitening, and these refer to whitening procedures that involve shining some type of high-intensity light on the whitening gel, the thought being that it can activate the whitening gel or make it occur more quickly. And I haven't seen a study done where they've found that the light is helpful. We wish it were. We wish there were some kind of magic bullet to make things occur quicker. Usually what happens with the light is that it does, most of them do have some ultraviolet rays, and so you do get some tanning of the lips and the area around there. And so as your lips get more brown or darker, your teeth look lighter, and also the fact that you've got that heat source on there tends to kind of desiccate or dry teeth out. And as that happens, as your teeth dry out, they look whiter. If you'll just hold your mouth open and dry your teeth off, that will actually make your teeth look whiter as they dry out. And so, while we'd really like for those lights to work, I haven't seen any independent studies that suggest that they truly do make a difference. If someone is aware of one, please bring it to my attention. I'd like to look at it. We're always looking for the most effective way to whiten. So we have found that the most effective way to whiten is, and economical, is to make very accurate impressions of our patient's teeth. The reason it needs to be accurate is those trays need to fit precisely so that the whitening gel that's placed doesn't leak out. Not that the leaking out is necessarily a health concern or going to cause problems, but if that whitening gel leaks out of the tray, then it's not going to be in the place where it needs to be effective. And so I think one of the biggest downfalls, or people haven't had success with teeth whitening in the past with trays, is that the trays probably weren't made to fit as precisely as they need to be, and that's sometimes kind of a tricky thing to do. The other aspect of teeth whitening is that the proper gel is selected, and the best way to whiten at home is while you're asleep at night. And you need to make sure you get a gel that isn't expired, that's relatively fresh. Most of these peroxides have fairly short half-lives, probably even shorter shelf lives, even shorter than probably indicated on their packaging. But usually if you use a 10 to 12% carbamide peroxide gel that's relatively fresh, and a tray that fits well, you're going to notice some great results very quickly, and that can be done relatively inexpensively by most dentists. I know many are offering that for free. I do wonder about the ability to spend the time needed to make trays if you're doing it for free. In our office, this process costs about $175 to do the top and the bottom, so it's not too expensive, but there is some expense involved. And then for those patients that just can't see themselves wearing a tray at night or for an hour or two each day, we do some in-office whitening with some similar products and get some great results. So as far as over-the-counter stuff, if someone can stick with it and stick to the program, there's the Crest White Strips and other things like that will produce the same results. They can be a little slower. And I think the other thing to remember is that there are certain types of discoloration, and sometimes you need a dentist to help you identify those, but sometimes people have kind of an orange spot on a tooth, or it's not just generalized discoloration, but it might affect just an area of the tooth. And those can be whitened sometimes, but usually it's not the type of thing where you're going to get where you want in a couple of weeks. It's usually the type of thing that'll take a couple of months. So that should do it for the update on teeth whitening. If you are interested in more information, I've spent quite a bit of time giving some facts about some of the additives and things that people might consider as they whiten their teeth. So hope this wasn't too long, and it's our first blog post, so hope you enjoyed it. Thanks.